This is Jerry Hesch. I'm an orthopedic manual physical therapist. I specialize in treating joints throughout the whole body. And in February 2020, I will have a book chapter coming out in a book called Human Motion. And it is on treating the upper cervical joints, specifically the first and second vertebrae, C1 and C2, also called the atlantoaxial joint. My client is an orthopedic surgeon, and he presents with a lack of traction mobility when his upper cervical spine is in slight extension. And what I'm suggesting is that at some point he had a hyperflexion trauma, which may have wedged the atlas in flexion. And I'll show you how we isolate that motion for testing. On a separate video, I'll describe this pattern on an anatomical model. He's laying with his neck in neutral. And when I palpate the mastoid process and I come on the front aspect of it, I can push posteriorly on either side and I get a little bit of rotation. And this is primarily in the occipito-atlantal joint. It's a very small motion, few degrees of rotation. And now I come beneath the mastoid and I lift up towards his ear and I lift up in that side bending. So this is the joint where the head, the occiput, joins the C1 vertebrae, also called the atlas. Now when I come underneath the mastoid, I notice that there's a deep sulcus. And that's a hint that he might have a hyperflexion injury, that the atlantoaxial joint might be in hyperflexion. I'll build on that a little bit. When I'm on beneath the mastoid and I'm on the transverse process of the first vertebrae, I try and glide the first vertebrae to the right and there's no movement. And I'm doing it on the right side as well, there's no movement. And I come underneath that to the second vertebrae and you can see there's free and easy movement. Okay? I can come underneath that bump that's right below the occiput and midline, and that prominent bump is C2. It's the spinous process of C2. And I can lift it up and there's free mobility. Then I flex the neck just slightly and I come above that in the midline of the neck and below the occiput, and I'm now in the spinous process of C1. I try and lift that up towards the ceiling and there's no give. That's restricted. Okay? To test the upper two joints in the neck, your traction force needs to be in front of the earlobe or in front of the mastoid. So my contact is on this part of his face and head. And so I contact like this. The fingers don't really do anything. And I pull, and there's good movement there. In fact, I see his lower body move a little bit, and then I can do an extra tug, and I can see movement translating throughout his body. I now test him in slight flexion, about 10 degrees of flexion, forward bending. I can take up the slack easily, and I can spring it. Okay? And when I put him in extension, he should have normal mobility, except that that atlas appears to be stuck in forward bending. And when I try and do traction, there's no mobility here at all. There's no give. And that is the definitive test with movement in neutral and movement in slight flexion that I use to discern that there's the possibility of the second joint in the upper neck being stuck in hyperflexion. And the treatment is to take it in a slight degree of extension. I'm only going to hold him in about 5 degrees of extension. And then I'm simply going to impart traction, and there's so little movement there. But I'm going to maintain this traction force for 3 minutes. So I'll stop filming now, and I'm going to maintain this traction force in 5 degrees of extension, and then we'll retest everything that we demonstrated. So I'll stop filming now.